Hello all. We are going to learn today about fetal circulation. So objectives of this session is we are learning embryology of the structures involved in fetal circulation, physiology of fetal circulation and the mechanism behind it. So what are the changes that will occur in fetal circulation after birth and some applied forensic and medical legal aspects related with fetal circulation. So coming to the fetal circulation. Fetal circulation occurs between these structures, that is maternal vascularity, uteroplacental unit, umbilical cord with umbilical vessels, and growing fetus. So it mainly exists for two main reasons. Like one is to deliver the nutrition to the growing fetus, one is for gas exchange. Placenta is the site for gas exchange in case in utero. Unlike lungs is the site of gas exchange after birth. So, placentation. How this placenta formation occurs? After the formation of zygote, cell division starts to occur. Once cell division reaches until 16th cell stage called morula, it will absorb the fluid within the uterine cavity to form blastocyst. This blastocyst will have outer trophoblastic layer, inner cell mass. This blastocyst gets implanted within the myometrium there, the outer trophoblastic layer invaginates and form a finger-like projections called villi. And the maternal blood vessels will also have a spiral course where there won't be actual structural capillary network. Instead, the maternal blood vessels will open in spaces like this lacuna. And the villi will have this blood vessels which will carry the oxygen from the maternal blood and the nutrients from the maternal blood and deliver the waste products and carbon dioxide to the maternal circulation. So the exchange occurs through diffusion instead of the actual structural capillary network. Coming to the morphology of placenta. The placenta has two surfaces, maternal surface and fetal surface. Maternal surface will have cotyledons, that is like this bumps, like because the invagination of uterine vessels within the myometrium and the spiral artery having the course. On the fetal surface, it will be smooth. So placenta will have weight around 500 grams near term. It will be around 20 centimeter in diameter, oval and round in shape. Thickness will be around 2 to 2.5 centimeter. So we have to make a cut section of placenta to look for the consistency. The cut sections will be made at 1 to 1.5 centimeter interval or 2 centimeter intervals. On cut section, we will look for infarcts, thrombosis, any infection or hemorrhage. In case of minor girl rape and illegal abortion has occurred, the aborted material will be sent to us for DNA fingertyping. It is used for fixing the identity of person of accused. So character specimen will be preserved in -20 to -70 degree in freezer, not in the formalin because it will denaturate the protein, which will lead to difficult for DNA extraction. So coming to the placenta weight, around 10 to 12 gestational week, the placenta will weigh around 51 grams. Around 14 weeks, around 3 months, that is 66 grams. Around 16th week, it is around 85 grams. Around 18th week, it is 110 gram. And around 5th month, that is 20th weeks, it is 141 grams. So, if in case we are doing a postmortem in a female and while doing the examination of uterus, if we are finding the conception products, by the products of conception weight or the placenta weight, we can able to arrive at average gestational age or the period of gestation. Also from the aborted material, we can able to identify the gestational age. So far we discussed about the placenta. Now we are going to discuss about umbilical cord. Umbilical cord will have umbilical vessels. Initially, there will be formation of two umbilical veins and two umbilical arteries. But left umbilical vein only be left, whereas the right umbilical vein disappears in utero. This left umbilical vein will have a straight course, whereas the umbilical arteries will have spiral course twisted on the umbilical vein. Even the difference in the course of this artery, there will be a resistance that is exerted on the umbilical vein, which can lead to effects on the fetus. On cut section of the umbilical cord, we can see umbilical vein, two umbilical arteries surrounded by the Wharton's jelly. It is usually providing the cushion effect to the vessels so that preventing damage, and also it is rich in stem cells which will help in repair of fetal growth. So, coming to the examination of umbilical cord. In umbilical cord, we have to look whether the cord is tied, torn, or burned. There are some ritual where cord burning is done, as in this picture, and we have to look for the stump, whether it is moist or pink or inflamed, whether the cord has any meconium stains which indicates fetal distress, whether the cord is attached with placenta or not, the cord insertion is at center or marginal or eccentric, and after delivery is there closure of vessels, and we can send it for histopathological examination to find out the signs of live birth. Usually the normal length of the umbilical cord will be around 60 centimeter. If the length is beyond more than or equal to 100 centimeter, it is called long cord. Usually the long umbilical cord predisposes to cord around the neck. It is called nuchal cord or twisting of cords, umbilical strictures. The diameter usually around 1.3 centimeter. So far we discussed about how placenta formation occurs, how umbilical cord starts to develop. So while placentation and umbilical cord starts growing, parallelly within the fetus, there will be formation of heart. The formation of heart starts around 3rd week and it gets completed by 8th week, like the whole septum, septation with all 4 chambers are formed by 8th week. So this is the timeline showing around the end of 3rd to 4th week, there will be cardiac cells that will form primitive heart. At the end of 8th to 9th week, complete heart formation with septation occurs. Whereas, as earliest as possible, the heart starts to pump, like cardiac activity starts by 6th week, which can be detected by transvaginal ultrasound. This is the picture showing the cardiac activity within the yolk sac in transvaginal ultrasound. This is fetal echo showing fetal circulation. So, we have discussed about how placenta is formed, umbilical cord is formed, and heart formation. Now, the formation of blood for the fetus. Initially, the blood cells are formed, that is hemopoiesis, that is primitive hematopoiesis occurs within the yolk sac. But those are immature cells. The maturation occurs at the placenta itself. Later on, once the heart formation occurs along with thymus, thymus will start producing the blood cells, and from the liver, later on from the bone marrow, where the production and maturation occurs at the same site. So this is the total picture showing the uteroplacental unit with the fetus and the umbilical cord. This is a real life specimen, umbilical cord, placenta, and the fetus. So coming to the physiology of fetal circulation. Okay, so umbilical vein, the red color represents oxygenated blood. The purplish color represents like mixed blood. There will be mix of oxygenated and deoxygenated blood. And the blue color means deoxygenated blood. Here, the umbilical vein, which carries the oxygenated blood from the placenta and it enters the liver, whereas liver doesn't need as much of oxygenated blood. So, 60% of oxygenated blood will enter the thoracic IVC through a shunt called ductus venosus, whereas the rest of the oxygenated blood will enter the hepatic circulation through porta hepatis, that is through joining with left branch of portal vein. So from the thoracic IVC, this oxygenated blood column enters the right atrium, where it is guarded by a valve, from which it is directly shunted to the left atrium through a foramen called foramen ovale. From left atrium, it enters the left ventricle, and from the left ventricle, it is pumped into the ascending aorta and the arch of aorta, where there is the three main branches supplying the head and neck and brain. So most of the oxygenated blood is redirected into the arteries supplying the upper part of the body, that is like head and neck. So brain gets the maximum amount of oxygenated blood, which will help in growth of the fetus. So this is about the oxygenated blood circulation. So coming to the deoxygenated blood. So from the lower part of the fetus, deoxygenated blood gets collected from the abdominal IVC. It is also enters thoracic IVC that where there will be some mixture of oxygenated and deoxygenated blood, but there will be separate column that is like deoxygenated blood enters into the right atrium, and from SVC deoxygenated blood of the upper part of the body enters the right atrium. The both deoxygenated blood mixes and enters right ventricle. From the right ventricle, it enters the pulmonary artery. But the alveoli in the lungs is filled with fluid, so there will be high pulmonary resistance. So the blood circulation into the pulmonary artery will be resisted by the fluid in the alveoli. So that there is a shunt called ductus arteriosus, which connects the pulmonary artery with the arch of aorta after the emergence of three main arteries supplying upper limb. So this ductus arteriosus shuns the majority of the deoxygenated blood into the descending aorta because lungs is not functional. So it has to be sent into the descending thoracic aorta. It enters the abdominal aorta. This abdominal aorta branches into common iliac arteries, whereas like common iliac artery will have external and internal iliac arteries. From two internal iliac arteries, two umbilical arteries will arise that will carry the deoxygenated blood, and it will enter the placenta where there will be elimination of carbon dioxide and gas exchange occurs. So this is just showing the how much percentage of oxygenated blood enters the heart and the brain. So this is the closer picture showing all three shunts. This is ductus venosus connecting umbilical vein with thoracic IVC, foramen oval between the right atrium and left atrium, ductus arteriosus connecting the pulmonary artery with arch of aorta. So after birth, what happens to fetal circulation? So as soon as after birth, the umbilical vessels will start to contract. The tunica media will have contraction. So that will narrow the lumen of the umbilical vessels. So one is like placental resistance will go off. Another, the backflow of blood from the fetus to the placenta will be stopped because of this mechanism. And also, after the first cry, when the baby takes its first breath, the alveoli which has fluid will be replaced by air. So, in fetal circulation, it is a low pressure system. From right side of the heart, blood goes into the left side. Right to left shunting occurs. Lungs is non-functional, and there will be increased pulmonary resistance because of fluid within the alveoli, and systemic resistance is very low. Whereas as soon as after birth, the shunt is shifted, like from left to right, blood flow starts to occur. Lungs becomes functional because the fluid within the alveoli get absorbed and filled with air. So there is decrease in pulmonary resistance. Since the placental resistance goes off, systemic resistance increases, thereby indirectly influencing the left ventricular myocardial contractility. So functionally, all the shunts will go for closure. So this is the picture showing the changes in circulation after birth. After clamping of umbilical cord, the blood supply through the umbilical vein get reduced, and the blood entering the right atrium is also get reduced. So the pressure drops within the right side of the heart, whereas the lungs will become functional, pulmonary resistance will decrease. So blood supply from the right ventricle enters the lungs. From lungs, gas exchange occurs, and oxygenated blood enters the left ventricle. And since the placenta is cut off, placental resistance go off and systemic resistance increases. Because of increase in systemic resistance, the myocardial compliance will also increase. Also, the blood flow from the lungs enters the left ventricle. Left ventricle stretches to an extent so that contractility also get influenced. So the proper circulation will get established as soon as after birth. So what happens to the shunts that is within in utero? Ductus venosus, functionally it will closure within few minutes after birth. Ductus arteriosus will close within 10 hours to 96 hours after birth. For Raman oval, within few minutes after birth, it will functionally close. Like the shunt won't happen. Anatomical closure occurs for ductus venosus around 7th day. And at end of the week, ductus venosus become ligamentum venosum. Ductus arteriosus closes by 10th day. It becomes ligamentum arteriosum. Foramen ovale becomes fossa ovalis. That is, anatomical closure starts by 2 to 3rd month, but complete closure occurs by end of 1 year. So those are about the shunts within the great circulatory system. So what happens to the umbilical arteries and umbilical vein? Two umbilical arteries will become medial umbilical ligament in the posterior aspect of anterior abdominal wall. If we see the back side of the anterior abdominal wall, we'll see two folds on either side of the umbilical fold. This is called medial umbilical fold. This is the remnant of umbilical artery. Whereas the left umbilical vein will be ligamentum hepatis teres. This is the ligamentum teres. This is ligamentum venosum. That is ductus venosus become ligamentum venosum. So this is a gross specimen showing the fissure for ligamentum teres, ligamentum venosum. Another gross specimen showing ligamentum arteriosum between the arch of aorta and pulmonary vessel. Fossa ovalis on cut section of the heart. So what are the umbilical cord changes that occurs after birth if the baby is born live? Based on this also we can able to ascertain the age of the baby in days. So as soon as after birth, the umbilical cord stump will start off change in color, that is yellowish to green. It slowly blood supply gets cut off so that it becomes brown color, and then the stump starts to shrink. The skin of the skin around the stump will be of same color. Gradually, it will fall off by 2 weeks. So, if any newborn which got died after few days after birth, based on the umbilical cord stump changes, we can able to come to one average or approximate age of the baby in days. Coming to the applied aspects in fetal circulation, like if any abnormality that can occur within the placenta cord or the uteroplacental unit, in the heart, anything that has structural abnormalities can lead to intrauterine growth restriction, preterm or like small for gestational age babies, IUD stillborn. So this is placental abnormality, circumvallate placenta, where fetal membranes will fold on maternal surface. It will lead to, it has high risk of preterm birth. Umbilical cord knots, this can cut off the blood supply and can predispose to IUG or an IUD. These are the cord abnormalities like nuchal cord, which can have marks similar to strangulation. Like this is the hyper twisted, hyperlooped umbilical cord strictures, and there can be some abnormalities in the cord insertion also. If the cord insertion is not central, it can be marginal. It can be like eccentric, filamentous insertion. The vessels can branch off even before the insertion itself. And some congenital cardiac defect, especially in tetralogy of Fallot and transposition of great arteries. The baby will start to develop cyanosis as soon as after birth and end up in fetal death, like newborn, neonaticide. So we have to look for any congenital heart defect in fetal autopsy. If at all the baby is born live and dead postnatally. So these are some specimens showing fetal death. So these are some specimens from our anatomy lab. Like this is the different size of the heart as the fetus grows. This is the fetus within the amniotic sac. This is how the specimen looks like even when we get some specimen that is sent for DNA profiling or for medical legal issues. So these are the different sizes like 20 weeks fetus with placenta, this 23 weeks, 24 weeks, 28 weeks fetus. This is a complete term baby, like 38 weeks. So from this, like the umbilical cord is clamped. So it means the baby is born live and died few days after birth. Here they did dissection on the baby to take out the organs. This is not the proper dissection, but this is how like central incision is made. This is IUD with mummified fetus, like intrauterine death, which has become mummified, the specimen of the fetus. So far we learned about the fetal circulation and the timeline, how the shunt closure occurs. Let's sort out this quiz. A teenage girl delivers a baby in secret, claiming it was stillborn. The body is recovered after several days, complicating for forensic analysis. Autopsy reveals ductus arteriosus, which is partially closed. Ductus venosus is closed. Lungs are fully expanded and float in water. Raygaard's test is possible. Raygaard's test is nothing but the lung along with the heart is taken out and it is put in the glass jar. If both heart and lungs float, the lung is separated and both lungs are again put in the jar containing the water. If the lung floats, the cut section of lung is made and the cut section is also put in the glass jar. If the cut sections of the lung also float, it means the baby is born live. The actual reason behind it is like after first breath, the fluid in the alveoli gets replaced with water. So it will become lighter. So it won't sink in the water. Liver is used as a control while doing this test. And there is some non-conclusive evidence like petechial hemorrhages on the face and conjunctiva. So coming to the question, what is the partial closure of ductus arteriosus and the complete closure of ductus venosus indicate about the survival time? So we learned that functional closure occurs like within few minutes. So ductus venosus closes by seventh day. Ductus arteriosus starts to close by 96 hours and it's completely get closed by 10th day. So based on this, the average survival time is like baby would have survived more than 7 days. That is, ductus venosus is closed, and less than 10 days because the ductus arteriosus is partially closed. It is averagely the survival time is between 7 to 10 days. So whether the baby is stillborn or live born, the baby is live born because the lungs are floating in water. Agar's test is positive, and the shunt based on the shunt's fate also we can able to determine the death is after postnatally. So the key takeaways from the fetal circulation is from the fetal circulation status, whether the shunt is open or closed, it is we can able to know whether the death is intrauterine or postnatal. From some basic aspect like weight of the placenta and the timeline of the shunt closure, we can able to come at the approximate age of the fetus also. Like it acts as a corroborative evidence, and lung expansion will confirm whether it's live birth or stillbirth. Some umbilical cord pathologies, placental findings, and toxicology are crucial in forensic investigations to know the manner of the death. And some maternal conditions like drug abuse, like opioid abuse is common, like their poisoning trauma can significantly affect the fetal death mechanism. So that we will know the manner of death and the legal aspect related to it. Thank you.